Melissa Methven joins me to discuss her book, The Truth Behind the Smiles, where she discusses the tragic death by suicide of her husband, who was a dentist, but also remarkably the amount of healing that comes forward when we stand and speak our truth, which is exactly what Melissa is doing in an effort to not only heal herself and her children, but to help the world. So please tune in to this incredibly impactful episode with Melissa Methven. Welcome back to On the Cusp. I'm your host, Dr. Brett Gilbert, and this episode just feels different already. And the guest that I have is just someone that I've gotten to know very recently, but I've really gotten to know because she has written such a powerful testimony on pain, grief, loss, but also on hope and healing and love and family. And she's a dental hygienist. She's going to tell her story, which is a very, very powerful one. And it's something that I feel that, when you find someone in the world that's willing to rip off the band-aid of covering things up and making pretend that as humans, we don't suffer, that's someone I want to be on a team with. And so I'm so grateful to be able to co-create today with Melissa Methven. And I want to welcome you to On the Cusp.
Oh, thank you very much for a lovely introduction. I'm so honored, Dr. Gilbert. I've been so excited ever since you reached out to have a conversation with you.
Thank you. Thank you. And yeah, we were introduced by amazing guy, Dr. Mike DeLuke. I was just recently on his podcast. He's scheduled to be on mine. He introduced us. But what I love about Melissa also is she's like, let's do it. So here, just a few days later, we are rolling and I am so excited. So first and foremost, I want to acknowledge that as we start every single day, right, we can be worried about what's going to happen, or we can be in a place of gratitude. So, Melissa, I wanted to ask you as we get started here, and you're sitting wherever you are. I believe you're probably in Arizona, but what are you
Yes.
feeling grateful for today?
I'm grateful that I get to use my voice, that I get to use my voice with ultimate freedom and share my story in hopes to save a life. Ultimately, that's kind of where I feel very grateful for my health, my children, where I'm at today, that I was able to heal and to be present with my children.
And that's what's so powerful about your story. And I of course, it will only be with justice to have you tell it yourself, whatever part of it. I want this to be a forum for you. Melissa's book is called The Truth Behind the Smiles. And as you can see, it's a picture of a beautiful family. The frame is cracked. And as she very openly, vulnerably, and to her point, intentionally has really opened herself to the truth, opened herself to her life experience, where she's been. And then what's most amazing is to see that even in the depths of the worst possible scenario you could ever imagine in your life, to see how the spirit of a beautiful human being can rise up, make changes, learn, trust their gut and intuition, and find ways to not only heal themselves and her children, but to also be just this beacon of light and awareness for so many other people that we know who are suffering in silence. So on its front, Melissa, and I'll just preface it here and I'll let you take it. On its front, we know that as dentists, the smile, the good attitude, the friendliness, the empathy, it's really good for business, but it's not always what our truth is. And so it's not easy, but most dental professionals put on that face, they put on that personality, and they walk into that operatory, good, bad, or otherwise. But the key is who are you when you're not walking into that operatory? And can we be honest with ourselves of where we are? And most importantly, when those that you know love you are asking you to assist you and help you, can you open yourself to being vulnerable enough to do so? Melissa, I'm going to let you take it from here. I don't know, I've read your book, so this is a much more deeper version. And I highly recommend that anyone who is alive, basically, because at first I wasn't sure if this was dentally related, and it is. The dentistry comes into it significantly, but it's so much more than that. Melissa, the floor is yours.
Well, thank you very much. Yes, I think This book was a lot of part of my healing, to shining the whole truth, because I truly felt that my husband, who was a dentist over 15 years, and I was a dental hygienist, we both worked together in Wasilla, Alaska. We put on such a face, this big smiles. And my husband used humor often with his patients, and he was a perfectionist. And we really shine this smile. But that picture on the cover of my book, I remember exactly where we were at as a family. And there was loneliness, there was sadness, there was, depression. We felt kind of stuck. So that's why I really wanted to use that. And it was really hard for my husband and myself to honor our truth. And that was a big disservice. So that was a big part of me writing my book, because I want people to learn from our lessons of hiding behind our smiles, and how that was a big disservice for our own mental health and physical health. For myself, not being able to express my true emotions and all that suppression that I did just to hide, I got chronic illness. I ended up having gut issues, to the point where I can only eat bone broth and some crackers.
Mm.
And I'm seeing doctors and they're saying, well, you have GERD. And I'm like, GERD? I exercise regularly. My husband would always mock me for all the organic things that I buy and all healthy things. And I was like, that just didn't make sense. So slowly my body was really starting to talk. I mentioned those things in the book. And for me, that's where my body was starting to have signs of chronic illness. And for my husband, how I saw his suppression from, we all have things from childhood that we need to kind of go back and work on. And likewise with him and all that suppression, he numbed. The minute he was done with work, it was a drink, and it was a heavy drinking over the weekends. And then all of a sudden it was the back pain. Well, there was a lot of numbing agents with the opioids got introduced early on in his career. And and that was just a numbing, so he wouldn't feel. And I still remember people at one point, I did feel numb as well. I didn't feel happy, didn't feel lonely. I just felt completely numb. And so my book addresses how seeing your truth could truly help you, give you that freedom, and also allow yourself to feel. And as scary, it was so scary for me to see my truth. I still remember rocking. I just had Sophia, and my husband was out of work for about a month. He had laid out his back. I was getting prescriptions from two doctors. There was alcohol involved. And I was like, but I was so happy to see this brand new baby. And so I blocked it out. I completely blocked out my whole truth. And even though I had called one doctor saying he's getting two prescriptions and really shining a light on it, it was just really hard to dive right in and share that truth and ask for help, because sometimes that's scary. That's scary to see your own truth. And for me, after my husband died by suicide in March 22, I knew to uh, not drink alcohol. I didn't drink alcohol for almost a year. I had to just sit in the pain and feel, reach out, accept help. That was really hard for me to accept help. And and this was all because at the hospital, one of the staff had mentioned that I need to get help first, because I was frantically looking for help for my children. Uh, at first, I was looking for counselors, and they said, no, you need the counselor first, because your kids will mirror your grief. And that really struck to me. And I dove right in with my first appointment over Zoom. And I remember this counselor getting me to do a breathwork session. And for 10 minutes, and I still have that email where I say, wow, just that 10-minute breath work, I felt that calm, that peace. And for me, I knew I've connected to God. I
Mm.
really did. And at this point, I was my heart was palpitating. I was getting chest pains. I couldn't eat, couldn't sleep. So to feel that calmness is because I had to go within. And that moment of stillness allowed me to feel that peace. So then I dove right into incorporating breath work. I was already doing like gratitude prayers. I was already, changing my thoughts a lot, even before when I was younger. That was just my process. The way it was always positive, but even more to a bigger scale after my husband passed away. I was really had to know to work in the now. I couldn't change the past. I had two young children that was 6 and 8. I had to take one step forward each day and just have a plan each day. Just focus on one thing, or else it's too overwhelming.
Mhm.
There just was too much to do.
Well, having now read your book and understanding and what I want to acknowledge is just you really put it out there. You really allow the reader to feel, and your message is that's the whole point, is to feel the feels, right? And not suppress them. You use the word suppression a lot in the book, and it seems to be in some ways a really significant theme through the course of your life. To be honest with you, the word and the way you used it, I really think it's worthy. Would you mind just telling our listeners a little bit about what it means when you're sort of acting in or using suppression to sort of manage certain emotions or lack of certain things in your life? Can you talk a little bit about suppression? Because what it seems like is that that's been such a common theme both for you and your husband Scott in some ways, and I think a lot of us can relate because what I took from your words in the book was this is something that in some ways we're taught, right? We're sort of taught to push things down. Can you talk a little bit about that, Melissa, and the journey with that?
Yes. I would love to. And ultimately, once I started my healing journey and counselors, I was able to look back to when I was a young girl and be, why was I not, really scared to use my voice? Where did that start from? And actually, I realized it started from a young girl where I crave my dad's love. My father was not in a place when he had me where he was emotionally available, and I mean, we're a great relationship now and I love him so much. But at the time, and so I craved his attention and him being there. And every time I would meet up with him and have visitations, I just put on a smile because sometimes I would cry. I'd be so emotional. And I remember him saying, "Don't cry," because that was so hard for him emotionally. He couldn't handle that. So then I said, "Well, I don't wanna not please my father." So I learned to hide those emotions. The crying, I suppressed that. Where I'd hide. I remember hiding it in bathrooms and cry and come back out with a smile. I never wanted to I always wanted to come in a room and with a bright smile, a positive energy, so then everybody feels good. Such a people pleaser and everyone to, uh, you know, um, and that trickled out into my marriage. When things would happen, I'm not going out there with my friends and burden them with our marital issues. And I just want to keep the peace, even in our relationship. I avoided conflict whatsoever, but didn't allow me to have boundaries, which is so important to have. And so that's where my suppression started. I learned that from a very young and child. And even sometimes I'd get really upset because I'd hear my husband telling my son, "Stop crying." And I said, "Well, no, let's not do that. Let's not teach them that. They've got to be like you be able to feel and process those emotions." And but that's, I think, a generational thing, right? If I can think of my husband too, he was like the Superman. He's like, "Oh, we'll get over it," and he's could do it all on his own. And that was very much the mentality that he was taught as well. So I think that starts from a very young age, and why I'm trying to change that now, plant those seeds at a young age with my own kids, that it's okay to have those big emotions, but this is the healthy way to process them. And unfortunately, if this all happens, you start suppressing at a young age or throughout your life, it's still going to be part of you. So if you never use tools to express those emotions, the sadness, the anger, it's still in you. Just like the book, The
Mm,
Body Keeps the Score. There's going to be parts of you. And that's kind of what I worked on a lot with my counselor was it was called parts work. And we went back to those moments and I would visualize that little girl or that young woman and see what she needs. What does she need? And then we got to let it go. So showing that love or a hug or whatever that was, but to revisit it, not to to relive it, but to revisit it and see what it needs it, nurture it and let it go.
mm.
So then you don't have to keep it and make space for joy, make space for other emotions. If you keep, I always talk about the analogy of the backpack for me because I love hiking. So if you keep adding these emotions and never release these rocks, you're going to slow down. You won't be able to reach that peak. And that's ultimately, you've got to sit in it and feel it. And then it could, you got to give yourself grace too. And patience. It's going to take time. It's just
Whew.
a lot of hurt.
It's the truth. That's the truth. And I just looking at there's so many layers to your story. And ultimately, when you hear about Scott and obviously the dentistry, being a clinician, you mentioned the perfectionism, right? It comes up in
Mm,
every conversation. But outside of being clinicians, we are human and there are so many other things going on in our life. And I know, and I certainly hope all the listeners will read the book and get the full context. But it seems like Scott really had a lot that he was trying to manage, and it seemed like you really were trying to offer him help. Trying to get him to a place where maybe he could open up and all the things, really, quite honestly, that you're so committed to now, right? And so I think that anyone that's listening can relate to the stresses of the profession. The responsibility simply of putting your hands on another for the purposes of healing them. There's financial burdens, there's staffing issues. Nowadays we have reputation management. Like, there's just so much that's on our plate. Can you speak to, like, and you being a dental hygienist, just as well as any dentist does, can you speak a little bit, because there's just so many layers here, Melissa.
I
I don't know
know.
which door to open, but I'm feeling called because through the course of your own healing process and what has been such a beautiful intentional way of working to heal yourself, in the ability to help heal your kids who were very, very young at the time that this all transpired, and you really detailed the sequence of events so clearly. Can you talk a little bit about the stresses of being a clinician and what that can do, especially when there's other things? Because the other things are what no one ever knows about. But can you talk a little bit about, in hindsight, what a clinician can do to help relieve some of the burdens that they're likely feeling based on all of these responsibilities and stressors that are coming at them from every direction, all day, every day, knowing that dental practice, medical practice, what have you, is what's sustaining the livelihood of the family? Can you give some advice to our listeners on certain things that you might have learned looking back, and now with all the healing modalities that you're involved in, that could be helpful to start right away?
Yes, absolutely. Well, from my own experience and to see my husband getting right out of dental school and seeing that burden, the heavy burden of the financial aspect of the student loans. And then he's diving into working, and he then within a year or two wanted to open up his own practice. So we even so then now it's taking out student but he not only does he have student loans, he's now taking a bank loan to open up his own practice. And he worked 6 days a week. So there was a heavy pressure. And we even lived actually downstairs of the dental office. We had built an apartment down there. And I still remember the assistant, he would stop on the seat on the floor when he's ready to go up. And so it was just really trying to, I think that financial aspect came in right away. That was really heavy to work and to produce. And he was so efficient and a perfectionist, and he worked 3 columns 6 days a week. I mean, he was a machine, but I think he had this goal of paying that back in a certain amount of time and be successful. he actually had the business knowledge himself. But a lot of times in school, you're not taught that. And he had
Wow.
to teach that a lot to some associate once he brought in some associates because he did notice every time he would take a vacation, we'd go on vacation and he had something would always go wrong. So you're never off, and he'd have emergency calls. So, and he donated so much of his time. He was so generous because he would feel so deeply for his patient, just truly wanted to help them. But I think energetically, I'm there in the office. I can hear everything. There's people, crying and there's fear. And under that fear, a lot of times there's anger. People come in angry, and you're taking that on and you're trying to calm them down. Even for me, dental hygiene, when there's so much anxiety, you're taking that on for them and you say everything's, and you make it as comfortable as you can for them. But if you're never able to go home and express some of their fears, that stays in you. That's my belief. And I truly saw that with Scott over time. They added on with more chronic pain for his back and more numbing came in. Also, he would always say, I love doing clinical, but all the other things, there's always office drama, there's managing everybody. And that was really tough for him because he really wanted to please everyone.
Hmm.
He wanted his staff. I mean, he did till the very end. He bought lunches almost every day for his staff. We would do annual fishing trips in Homer. We did a big Christmas party. So he really treated them well. And that's why they're like family and they still are today. Even though I sold the practice about a year ago, but they're still family. I'm still connecting with them all the time because they were there with us for a really long time and they saw the progression. But I think the financial aspect, and unfortunately, my husband also got in a lawsuit. So I know a lot of dentists deal with litigations as well and how toxic and overwhelming that is. Because on a daily basis, my husband had to deal with lawyers and it's just so draining, really draining. And I think that once the lawsuit came into play, he kind of lost hope because now he was working just to pay for this fight. And it just became this obsession almost to he wanted the truth out and he wanted to fight till the end, till the end really to win, to shine that truth. But I still remember this is doing so many times say, let's just settle and leave it to the universe, leave it to God, leave it, to handle that. We're going to be okay. He's a dentist. I'm a hygienist. Even if we have to, I said, let's sell our home. Let's move, let's change because Alaska with the darkness and whatnot, I would see a big change in him as well when it came to the winters or long, dark winters. But it's hard when I think a lot of men are they put their worth, of course, in their profession. And his dental office, he did it. He opened it himself, even though his dad was a dentist, his brother was a dentist, came a big dental family. He could have gone and worked with them, but he didn't. He chose to do this on his own, and so that was his big pride and joy. And as far as the home that we had, he loved it. But so for him to let those things go was really hard, but I could see so much more happiness in that weight being lifted if we did, but I think that's big part of dentistry where it comes is that you feel, well, this my profession, that's what I studied for. I'm stuck there, and even even though actually at some point he was really good at endo, actually. He was really, really good. And he had a chat on WhatsApp with fellow general dentists giving him tips. And he had told me, maybe one day I'm going to teach. I'd love to teach endo or go back to school and do endo. And because he was really good at it. And so I think he just kind of in some way felt stuck and needed to kind of keep the office afloat. And there was a financial aspect. And unfortunately, a year before his passing, he had learned that his father was terminally ill with lung cancer. And that, it was just that whole combination. Life will throw at you so many challenges. And if you don't make space for the expressing and the healing, it just compounds so much that it's just too much, right? And he came to a point where he's so overwhelmed.
Yeah, and I think the story in itself, is so powerful because there's so much there. Like, first of all, you put your life and your journey, you put that front and center. You put your husband Scott's life front and center. And what as I'm reading it, I'm thinking to myself, gosh, any one of these things would, if it was just that he had a busy practice and was working so hard. For many of us, that's enough to essentially
Mhm.
push us down and get us to a point where we're feeling trapped. But he also had his father's illness, and he also had, you mentioned the pain, right? The back pain. And oftentimes what we've learned through the mind body connection is the powerful influence that our emotions have, and where we store, pain and trauma, which is in our body. You mentioned in the book something that you've discovered is just how dancing sort of opens us up, right? Because we store so much emotion in our hips. And so it was like there were so many things that Scott was trying to handle. And what really struck me as honestly the part that was the saddest was what seemed like a relentless effort on your part to try to move the needle somehow, some way, in any direction you could, to get him to sort of open up, vent, get some help. But ultimately, there was also the part about addiction. And I wanted to just, open this discussion up just a bit for this because I had another really amazing guest on the podcast named Dr. Brett Kessler, who is actually the president of the American Dental Association, like as of next week at the ADA convention. And he has a powerful story of recovery from addiction. And he explains how, once the brain is mired in addiction, it's kind of like a cucumber that becomes a pickle, and you can never make a pickle a cucumber again. And so I think you were dealing with so many things there with him, and it felt like you were trying to support him in such a powerful way. But what really got me was this idea that you ultimately cannot change someone else. You cannot step in and heal for someone else. And so, from your own voice, Melissa, with all the healing you've done, and I even saw an interview you did like with the local news talking about some of the things you've created in your home, like
Mhm.
a corner for your kids, and just very innovative ways where, like, the world is still fighting the stigma that it's not okay to be okay. It's not okay to not be okay, but it is.
Mhm.
Everyone is suffering in silence. And here you with your own truth, and you're speaking of suppression and what that's meant in your life, and you've opened your heart, and now you are such an advocate for others to explore their own mental health, their feelings, to recognize you're a breathwork facilitator, you use sound healing, you've tried everything. And so what I'm trying to say here is, if someone is listening and is in the presence of, maybe it's their boss, maybe it's their friend, maybe it's their spouse, maybe it's even one of their children or their parent, what would you say would be the best approach when you realize that it's hard to help someone else? How can you, because my intuition tells me that as we heal, right? You talk about that you said it was one of the kindest people in the book you ever encountered was the person in the immediately after Scott's passing, where they said, no, you don't need to look for someone for your kids to help them. You need to help yourself first, right? And I know you were a flight attendant, so it's that old, put the oxygen mask on yourself first. But can you speak to the impact on someone who wants to help someone so bad? What is it that they can do for themselves that indirectly then has a chance to permeate potentially and help change someone else? Can you speak to that? It's a long-winded
Yes.
question, but if you
Yes.
could kind of get to that.
Well, I always say if you're trying to help someone, because I know how hard that could be, is also to start healing yourself because
Mhm.
you're going through a lot of a grieving as well, and finding that stillness in that heart and doing these tools, and they can see that shift from you as well, and hopefully you can guide them through that. But also I also tell people, even if you don't know that person really well, but you can see that they're struggling, don't be afraid to ask them directly how they're feeling. Are they having suicidal thoughts? Are they, just dive right in because you could be that person to make the impact. I'd always, joke that I needed to send a decoy, to make an impact in my husband. But I know a lot of people communicated with him as well and shared their stories or almost dying by suicide. And they could see the battle, but you never know the impact you're going to have, even with a complete stranger. So always, if you feel it and you feel inclined, you're feeling called to ask questions or check in on someone, do, because you could be that person that will make them seek help. And, I wish I had a better answer because I know I've asked all those questions with my husband. I asked him, are you having suicidal thoughts? Are you, I had said, okay, there's better health. I had called the doctors on better health and said, you can just Zoom because Alaska had wait lists for counselors. I found a retreat he could go to with only 6 doctors, for addicts and whatnot. But a lot of it was he wouldn't see his truth. So until somebody goes in and allows themselves to see their truth, then that's the first step. And then you're going to reach out, just reach out to one person, call someone and share your truth. Remove that veil. Don't be afraid. There's going to be, and if you don't know anyone, call the 988 hotline. There's going to be someone on the other line there and you can share your whole truth without judgment, without shame. And I think my husband, there was just a lot of shame and guilt of where he was at now, because everyone thought of it. He was a great dentist, but he didn't want to remove that light, but that's okay. We can hold him in that. Nobody's perfect. That's
No.
the thing. Nobody's perfect. I'm not perfect. I've done a lot of mistakes too, but I can't sit in there. I can't camp out in my mistakes. I can only be live today. What do I want to do differently today? What do I want to work on today? And so I just ask people, ultimately, you have to go within. I know I moved to Arizona just 4 or 5 months after my husband passed. It was just all a calling and I knew nobody here. But I remember when I moved here, I said, what I need is space, not isolation, but I needed space. I removed social media, I removed everything. I just needed to sit because it was go, go, go. Everything that I had to deal with afterwards. I had the lawsuit. I had Scott had the office in bankruptcy. So I had, I don't know, too many of lawyers I had to communicate with. And I had no space for my own grieving. And so when I moved here, I just needed space. So sit in my stillness, a lot of meditation, a lot of journaling. And that's how I got into writing. Actually, I just journaled and saw how putting that out into the world really helped me. Even writing my book, I wrote more in there, more in detail, but I didn't want to keep that in the book, but it was just putting it out and erasing it. It put it out there and it's all very much part of the healing. And I tell everybody now to write a book because, write, just write every day or journal every day in gratitude. That's why I'm Melissa Gratitude, because ultimately every day I'd get up and find something I'm grateful for and look around and I look at my children, and their health, and I couldn't remove the pain. That was the hardest thing for me, looking at my children. And as a parent, you want to protect them. And when this happened, I thought I failed completely. And that immense amount of pain was just it's so hard for me, but I just had to know that I can't remove that pain, but I can sit with them with that pain and learn all the tools. I listened to so many because living in Western Alaska, there wasn't accessibility to so much, breath work like I do now, cold plunging, red light therapy. I do all those things now. But what I did up there was listen to actually a lot of podcasts
Yeah.
of people, how they got out of darkness, just personal stories. And I saw a common thread of what they were doing. And that was the getting up early and finding that stillness, the meditation, the writing. So I started incorporating a little bit here and there. I mean, my days were crazy busy, but it just took 5 minutes that I incorporated, or just putting my alarm clock earlier than I normally do. And that's how I found the space to do it. And I saw the little shifts in my mind and my body and how important it was. And even now when I'm, busy and I fall off of it, I notice it. I notice it. So I crave it. So now it's just part of my life and I know what to do to get back in alignment. And that's a lot of it is for me is breath work. Actually, through breath work, a place that I go to, Jeremy Mudick, he's a fantastic breathwork facilitator here in Arizona, and I was able to process some PTSD that I had from that day. Uh, I I still remember very vividly. It was like that vision came, and it was like, okay, the universe, God was giving me that vision. It was came so strongly, and He it took it away. It let it
Mm.
go. I had to let it go. I had to face it, and then just learn to let it go. And since then, I haven't had that issue. Because breath work too, I've been able to connect just to my heart and really know my purpose and where I want to go. That's how I was like, well, yeah, I'm writing a book. Yes, I'm using my voice. I'm speaking. I'm the one up there speaking now. And that's how I think you can truly connect to your purpose and your alignment. For me, is breath work, time in nature. I love hiking. We love camping, and so being out in nature is a big thing for all of us. And I've been incorporate once a week. I go red light therapy, cold plunging, sound bowl, you name it, because I was willing to try it all and see what
Yeah.
works for me, for my family, and what resonated for us.
Yeah, it's so beautiful, and that's really what my podcast is about. Because my own personal growth journey started also with podcasts, with Lewis Howes' School of Greatness podcast, and I realized the power of, this conversation will resonate with someone, and sometimes that's all they need is that little spark. But all the practices you mentioned are beautiful healing practices that, you take upon yourself, but they ultimately permeate because we're all frequency, we're all energy, and it permeates to others and it creates a healing environment that surrounds you. And so as a mom with two young kids all grieving, with having lived through so much trauma both before, during and after, this horrific incident, that you were able to really grab a hold of healing practices, and now you're facilitating and you're sharing. And I agree, journaling, it's a very odd thing and logically, but intuitively, there's something about writing and expressing it and letting it out. It's a release valve of thought, of emotion, of trauma, and it's something that's very, very helpful for me as well. Just having you here and having you have such a close association to suicide, and we recognize that in dentistry we have a higher suicide rate than the general population, and even amongst other professionals. But what's not talked about is the depression, the anxiety, all of these pressures that you've so eloquently already spoken about. I once took a class, I wanted to get involved with suicide prevention, and I took a course called QPR. Did you ever take QPR? It's
I
question,
have
persuade,
not.
and
Oh,
refer. It's a great, so it's qprinstitute.com. I'm pretty sure we'll link it up in the show notes. It's about a 45-minute class, but it basically, just like you said, it encourages you to ask questions, including asking someone, do you have a plan of how you will commit suicide? Because oftentimes someone will immediately feel an opening to express their plan. And that would mean, when you hear that, that person is actually getting very close to actually doing it, versus if you ask them if they have a plan and they hadn't really considered it, they're maybe just having ideation. And then it's the persuasion to, hey, there's outlets, there's you just mentioned the helpline, you've in this interview already and mentioned a number of different hotlines that you can call, and then ultimately referral, right, getting them to someone who can help them. And I think that when we talk about suicide, it's really a difficult topic to grab a hold of, right? Because there are people, you hear of the suicide gene, and I know in the book you mentioned that there was some suicide in Scott's family. So I interviewed someone named Frank King, who's a remarkable human being. He's attempted suicide multiple times. He's a speaker. He's incredible. He's actually someone I would like to connect you with, Melissa. I think you two would really be able to create something quite dynamic in terms of discussion points. But he talks about that for some people, it's a thought in their head all day long, every day, and that's something that ran in his family. And so, what I wanted to say is if you're out there and you do have suicidal thoughts, suicide ideation, call it. Maybe you're even considering doing it right now. I want to let Melissa speak to you directly because I've heard her now speak a number of, and I've watched a bunch of your videos, so it's more than the book. I did a lot of research for you, Melissa, but you have so many great ideas. You were just involved with a teen event that I thought was absolutely brilliant and just heartwarming to my core. Can you speak to someone who either has these ideations about what would you say to that person, and ultimately, what would be your advice to someone who is hearing this to be able to move into a place of help?
Oh, I would give them, I write a letter in my book to anyone that is feeling suicidal. And it's just love. I send them so much love and I don't want them to sit alone in that. A lot of times they isolate and they feel maybe they're a burden and it's just so overwhelming to have those thoughts every day. But I just want to say that they are worthy of love, to allow love back in, allow somebody to help them. Because I know so many people around this person. You can even connect with me. I have so many resources. Even that teen life, I love their concept. They get teens that were probably struggling. They were struggling, but now they're being of service and they've been trained to be on the other line. So it's a teen answering the other teen, which I think they can really, it's a connection I think that we're missing a lot, nowadays. And so they connect and then they provide hope. And that's it. To feel that love and that connection, you give hope to somebody. And so reaching out to someone, there's so many resources out there. Another one that I met in Arizona is called the Hope Institute. And it is they'll provide you with they'll look at the whole body. Like, where is that coming from? What are you suppressing? There's probably some trauma there that needs to be addressed. And so they'll look at it as a whole and give you the proper treatments and counselors. And I just want to give out so much love. And I always see on the other end, you'll find your most fulfilled life, but you just got to
Mm.
be willing to reach out to one person that'll give you that, hope. And I actually, my publisher, Kira Brenton, she almost died by suicide 3 years ago. But she reached out to one person and then she decided to make slight changes. She has 5 children, but now she owns a publishing house. She owns a Mosaic network, which was for a business. I mean, she's such a light, but I'm so glad she chose to live. So I tell everyone, choose to live. You don't know. We don't know what's ahead. Would I've known where I'm at now 2 years ago? No, but there's hope. Keep looking for hope. I have a few friends that have left abusive relationships, and there's so many questions, so much fear leaving. Because how are you going to be able to do it alone? I say you've got to pray. For me, it's God, the universe. You got to believe and ask for guidance, ask for signs, and doors will open. And be willing to take those open doors and never give up hope because you will reach that other end where you will feel more fulfilled. It's going to be hard, but don't ever and find your community. Ask for help. Find your community. I wouldn't be where I'm at right now without community. The community that I had, dental community. I had a big part, the AACA group, a dental group. They came and delivered meals. I found a chef for us in Alaska, cleaning services. Even now, they're a big supporter, and a lot of them wanted me to write a chapter about dentistry, the dark side of dentistry, because a lot of them are struggling financially, mentally, and they want solutions. A lot I'd like to see is you're in education, so let's start with students, dental students. Teach them those tools. Bring that awareness. That is, yeah, it's a great profession, but this is the hard. And this is how you're going to process that hard and have that community. So give them the tools to express everyone's fears. Give them that. And I want that in my kids' schools. I need to plant those seeds young. That needs to start with education and then having that support system. Even I think, oh, what if we have monthly or every 6 months, a check in at a dental office, check in with the spouse, check in with the children, check in with dentists, the front office. How's everyone doing? Removing that mask, somehow finding us something to connect with them on a deeper level where they don't feel alone.
Well, and you even at one point, and it's so beautifully said, Melissa, and your letter in the book is so powerful. She speaks directly, as I was mentioning. So I really, the truth behind the smiles, you just have to read this. There's so much in here. There's so much in regards to the pain that we suffer, oftentimes, just to your point, because of a lack of education. And it's not a callous deficiency. It's that our parents and grandparents, they didn't know. They didn't know how to manage trauma. And most of the time what they were taught was the suppression. You talk about the cocktail, fear, rejection, and suppression, right? This sort of cocktail of burdens that we almost self-inflict. Um, you have some call to action in your book as well, something that I feel like is completely in alignment with what I'm trying to build. My education platform is endodontics, but it's also personal growth and development. I'm right now finishing up so just a little on my background, Melissa, just how it relates to this and to any listener. I at age 43 suffered a severe state of burnout where I was really scared. It was something where I had a lot of pain in my body. My thoughts were negative. I was so unhappy in my profession. And I basically was so tired because I kept just pouring from an empty cup because I was more or less taught that being selfish would mean taking care of myself. Being selfless would be foregoing yourself so that you can take care of everyone else, right? It's in essence the dental theme, right? That's what dentists do. We give, 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 and we just empty our cup with nothing left. And ultimately, what happened was, is I wound up in this state of burnout, and I wound up really in a state of suffering. And I wound up doing some very powerful emotional intelligence training. And the emotional intelligence training literally changed my life because it allowed me to assess what was trauma and what needed to be felt. Like your book, you talk about like not suppressing it, but literally digging into it, those deepest, darkest places, the things that have hurt you the most. Because when something hurts you and it's trauma, it sits in your chest and a thought happens or something comes up and it's almost like a shard of glass. And every time you make a small movement, it cuts you all over again. So it continues to sort of be a part of you. And the amazing thing about trauma is if you scratch at it, you claw at it, and you bring light to it, it will it'll go. And then to your point, you open up this space for more joy, more creativity, more feeling of spaciousness. Because that's the thing about dentistry, it's a gilded cage. It provides a wonderful lifestyle, but it only provides it if you're spending your time at the chair grinding. And the more your family enjoys a great lifestyle, the more time you have to spend at the chair. So I've actually have developed with some experts an emotional intelligence program for clinicians. And so, in the same way that you might be in a position of either being unhappy in your career at the more severe end or potentially feeling unhappy with even being alive, I'm hoping that the more we can open clinicians and other people to the idea that, yes, there's a cocktail of fear, rejection, and suppression. There's a cocktail of not feeling like you're enough. There's a cocktail of feeling like if you're not perfect, you won't be loved. But none of that is really the truth. The truth is that we're all open for all the emotions. That's why we're here. And the more that we can get in touch with our actual emotional system and realize that the joy and the pain are just two different parts of one whole, right? The suffering and the enjoyment. We can't always be happy. If we can embrace all of our feelings, we can be a healthy person. And now all the stressors are easier to bounce off because you have so much goodwill built up inside. So I want to acknowledge you, Melissa, for not only the strength that you've shown and as a mother especially. I mean, the entire book is about you being this powerful mother who, even in the midst of a chaotic situation, even prior to, Scott's passing, you really did everything in your fabric to hold it all together. And now seeing like what you have like grown into in terms of embracing healing and modalities and then sharing it and your voice is so powerful. And so I want you to know that I totally will answer your call to action. I know you have some ideas of potentially having, like, in the same way you were mentioning the teen to teen hotline, maybe a dentist to dentist hotline where
Yes, I really
one,
want that. I was searching how to do that, how to start
yes,
it. I was looking for a name for it, and I really want to start it. I said, well, if I'm doing it. I'm gonna
yeah,
look into it, but I think this would be so. I feel like Scott would have been more inclined in calling this, knowing that's another dentist, and it could be a retired dentist or somebody like yourself that is for mental health. That we can have a training, but I think also this nonprofit could be going in to dental offices and maybe educating, for signs of burnout, for signs of,
absolutely.
and so, yes, that is a dream, but it's something that I
Let's
want
make it a
to
reality.
happen.
I'm
Okay,
in.
reality. Yeah.
I'm
Yeah,
in.
okay, great.
I'm in, and I
I'm
think that it's
excited.
so powerful because one thing you mentioned in the book that got me, you talked about that in sort of Scott's, there was a lot of turmoil, but you mentioned that he had joined an association. I think it was like American Academy of Clear Aligners or something like
Yes.
that. And you
Yes.
mentioned that his involvement there seemed to
Mhm.
sort of spark like some rejuvenation and some hope. And that to me is like a little bit of proof positive that this concept that you're trying to develop could be effective, because that's great community and camaraderie. But yet getting into those deeper conversations might be a whole nother level. But I think it goes
Mhm.
to show that, a dentist can understand, like, I can understand the pressures and I can feel them too, because I suffer too. I'm a full time clinician. I have my own practice. So I resonated with everything that you wrote in the book. But I also could see where maybe my insight to someone who is really suffering could really maybe give them even a bigger glimmer of hope, because there is a path. And I've taken a path that has helped me tremendously. So I just want you to know, let's work on. I'm sure Mike DeLuke, who introduced our
Yes.
the ortho coach,
Yes.
I'm sure he'd be in. I know a bunch of other dentists that I know would be so happy to step forward and to be a part of this initiative, Melissa. This would be such an incredible tribute to Scott, but also such
Yes.
an incredible life saving service to our entire profession. So I say, let's make it happen.
Let's do it. Yes, I love being on Dr. DeLuke's podcast as well. I think it goes live tomorrow, but yeah, there's no doubt when I was listening to both of you speak and how we got connected. I said, there's no coincidence there. And I would love for you guys to help me create this
We're
because
gonna
I
do
think
it.
it's important. Yeah, let's do it.
We're gonna do it. I have two more things I want to, two or three more things, and then we'll let you go. I'm sure you've got maybe a cold plunge this afternoon or some breath work. I did a little breath work before the session
Yes,
today.
I did too. I always do right
It,
before to get
it,
kind of grounded.
it's
Yes.
part of my life. It's incredible. But I wanted to just say, because one of the most moving parts of your book to me was immediately after, having to come back to Alaska, unfortunately, the passing, the incident, and you're very clear, and I'll just say it too, the death by suicide. You wanted to be very clear in using that language in a way to not be, in any way abstract about what happened. But you talked about how family and friends and community brought so much love into your life through this entire time. Can you just speak a little bit to how important expressing our love to each other and being there in support in a spirit of love meant to you in your own healing process?
Oh, wow. It was everything because I still remember because this happened where I was by myself in Hawaii, in Maui. Family had left. I was me and the kids and my husband when this happened. So a lot of people were checking in. What can I do? What can I do? I've been so trained to be so independent. I didn't know what to ask. But my friends in our community just came up, and when they picked us up at the airport, they had our dog. They had already gone. They had my code for my house. They had cleaned our house. They had prepared meals. They had cleaned everything. And they just showed so much love. They had my kids' best friends there to give them a great big hug. So then I had a big fear of walking into our home without Scott.
Mhm.
But I'd even asked for all this. I had a house full of friends and they're my kids' friends. And I felt loved. There was so much love. They actually had created a calming corner in my room. And that's why I recreated that here in Arizona. And this was a space of us to connect. So a lot of our friends just still connect. They call, how are you doing? And cheering me on as I'm going up. But I couldn't have done it without that community. People sending meals. We had the cleaning service. We had donations because now I had to get a probate witness. Scott had no will, so I had to take care of the office, do payroll. I had to now hire another dentist. So there was so much, so I had to ask for help. And that community was so loving. I still remember in that calming corner, I have these little feeling cards. So when it's hard for kids to express, they can grab a card and say, "Okay, this is what I'm feeling." For a lot of time, it was sad and mad. But one time, my son picks up joy, and this is maybe 3 weeks after we're home, and I was just shocked. And I said, why? Is because he could feel the love from the community, people dropping off baskets for them, checking in. They were getting a lot of play dates and sleepover because as I was moving, I needed a lot of help to pack this entire home. And so I became, but I saw that people were wanting to help because that gave them being of service joy to help our family as well. So
Mhm.
I always tell people, don't be afraid to ask for help. I know that was a really hard thing for me, and I want to always be independent. But that community, I couldn't have done it. And even if I moved to Arizona, not knowing anybody, ultimately I wanted to find a faith based school for my kids because I knew I couldn't do it alone and needed that foundation. And being able to walk to school, walk everywhere, find a family friendly community. I moved here and people are delivering, they don't know my story. They're delivering flowers, baked goods, cards, welcoming us in this community. I've moved into the most loving community
Oh,
in Arizona. It's called Agritopia. It's honestly, I have the best neighbors. Everyone says hi. Actually, when my friends come visit now, they call it in Smallville because everyone's so friendly. They're like, everyone's so nice. I'm like, yeah,
love it.
it's
Love it.
so this community as well is, and no doubt God knew where to put me. It's so
Mhm.
loving and they have been so supportive. And now that they know my story and they say, how can I help you? So they've come up as a community to help me rise,
That's so
which I feel so
beautiful.
blessed.
Yeah, and you do speak a lot in the book about just faith and trusting your
Mhm.
intuition and allowing things to happen. And most importantly, one of the more difficult lessons for dentists to learn and people in general is receiving. Sometimes we don't want to receive, we feel closed off to it, but by receiving and all the things that you received and the love and the acceptances of all the goodwill, you're actually giving because it feels so good to give to others, but you can't gift anyone anything if you don't allow their giving to land and to have impact. And so by receiving, we are actually giving. And it's so powerful both ways. Melissa, how can our listeners find you? I know you mentioned your Instagram handle. Can you talk a little bit about how they can find you? And of course, we are going to link up your book in the show notes. I want to say please buy this book, read this book. She also has it on Audible so you can hear it in her own voice. This is a powerful testimony to how we all struggle in different ways, how what we learned as kids isn't necessarily setting us up for success emotionally as we go through life. And one of the biggest threads here is how everything that we do, feel, and act has an incredible impression and impact on our kids. And if we want to stop these negative cycles in our families, we have to make the conscious choice to heal ourselves. And when you heal yourself, you heal everyone else around you. And I think, Melissa, you really stand. I know it will always be, right? You're never healed. We are constantly
Yes.
healing. But I
Oh,
think you have
yes.
a powerful testimony to, really coming through the darkness. And by doing so, bringing a light to the world that shines a whole different light that can really help people. And so I want to help promote anything that you're doing. So tell us where can we find you? Where can listeners reach out to you if they wanted to reach out?
Yes. Thank you. I have a website, melissagratitude.light. And you can find me on there. I also do virtual breathwork sessions. I do in person. I do a group as well because I think that's a gift that was given to me. And I wanted to learn all about breathwork and give that gift back because I see the impact that it has on so many people's lives. And also, I'm a speaker. If you want me to be able to speak at your event or instead, I'll share my story because I know there's power in sharing the story. Because when I share now my story, I have heard from so many saying, I've never told this to anyone, but they share their truth with me.
Mhm.
And now that allows them to seek help and resources and kind of relief, not feel alone. And so that's where they can find me. I, of course, Instagram's Melissa underscore gratitude. And then my book's on Amazon and Audible, The
And
Truth Behind the
we'll have
Smiles.
those links all linked up in the show
Yes.
notes.
Yeah.
Melissa, and I will connect you with Dr. Brett Kessler too, because I think you
Oh.
two could co-create. I've got all kinds of introductions I'm dying to make here. Our last question, and this is a question I'd like to close my episodes with, and I think it'll be very powerful for you coming from the place of what you describe as an 18-year-old. So if you were in front of an 18-year-old person, whatever that looks like, and they're sort of like want to make their way in the world, they want to have an impact, they want to have a great life where they contribute, but they also can enjoy everything that life has to offer. What's one bit of tangible advice you might offer to that 18-year-old as like one step that they can
Mm.
actually take that would maybe help facilitate them finding in this fulfilling life that they so desire?
Oh, wow. That's a powerful one. I always say, because I just think of myself at 18, it's self love.
Mm,
Self love for who you are. And don't try to be what society wants you to be. Like, live your truth. Just be completely free. And that self love, as much as you give out to the world and want to please everybody, you got to start with yourself first. So that's where I'd say to an 18-year-old, start by connection with you and what that is. Cause so many of them are, might not know what direction they want to go and they feel the pressures. They don't know what career they want to go into, but just go back into your heart, find that stillness, that self love, give yourself grace and be true to who you are to live their truth.
I mean, that is so beautiful because that's what I found in my emotional intelligence training was I realized that I wasn't loving myself. And, the most important love affair, the most important patient, the most important love in your entire world is the love within your own skin. And for many of us, it's a hard place to find it. And so my biggest transition in life is finding the courage to heal and to ultimately really embrace who I am and love myself. And so that is to me just basically the best advice you could possibly offer another human being. So, Melissa, I am so grateful for your time, for all the effort that you've put into sharing your story. Again, The Truth Behind the Smiles by Melissa Methven. We'll have it all linked up here. It's a story of faith, of love. It's a story of motherhood, of childhood. It's a story of suicide, but it's also a story of hope and healing and ultimately realizing that this life is one of which we're here to feel. And if we deny our feelings, we're denying our life. So dig into your feelings, accept them, sit with them, embrace all of them, the good, the bad, and the ugly, and think of it as just one big ball of this beautiful thing we call life. So, Melissa Methven, thank you so much for joining us.
Thank you.
I'm so inspired by your story. I have so
Thank
many
you.
more questions, so it's possible we're going to need to do an episode number two. But I'm
Yes.
so grateful for this one, and just really, really, just can't say enough about how much I respect everything that you've been through, how you've been able to put it all together in an effort to really show up in the world to help yourself, help your kids, and then help everyone else that's out there that needs it. So thank you, thank you, thank you, and it's been
Oh,
an
thank
absolute pleasure.
you. It's been an honor to be on your show, Dr. Gilbert, and thank you. It's such a blessing.
Thank you.